Alright, now we're going to move on to the postural assessment. So I'm just going to stand you from toe to head and just see what I find. So I see that your feet are laterally rotated, and I can't see your knees or your hips, but your arms are immediately rotated, and so is your shoulders. And I can see that one clavicle is protruding more than the other, as well as the shoulder is elevated. Your head also has a lateral tilt because I can tell from your ears. So I'm just going to go in and confirm what I see with my hands. So if anything hurts or is too pokey, just let me know and I will stop. So I can see that you definitely have flat feet right here, and your ankles are caving in slightly. I can feel that your calves, this one is definitely a lot larger than this one. Can you pull up your shorts? Thank you. And I'm going to feel these. Your knees are pretty even, however, your kneecaps, this one is pointing more that way than this one. And this muscle is definitely larger than this one, and these are definitely even. So put those down for me. I'm just going to feel your hips right here, and these seem to be quite even. As well as these two bones, they seem to be even, so you don't have any lateral tilt. Your hands seem to be even, however they are immediately rotated into the front. So, I'm going to just feel your ribs. Alright, and they seem even and nothing's protruding. And your shoulders are coming a bit forward, and feeling with my hands, I can definitely feel that this one's protruding more. Your head has a slight tilt, and I can tell because your left ear is higher than your left ear. Would you mind turning around to the back of me? So again, I'm just gonna see what I find with my eyes, and I see that your feet are laterally rotated, and your ankles are caving in, and I can definitely see that your right calf is larger than your left one. And your back looks good, however your arms are definitely evenly rotated, and again I can tell that your ear is slightly higher than the other. So I'm just going to go in and palpate what I see. So again, I feel that the backs of your ankles are caving inwards, and this calf is bigger than this one. And I'm just going to pull your shorts, and I'm just going to find your luteal fold, and they're pretty even. I'm just going to find your hips again, and again they look even. Drop your hands for me. Good, and these are immediately rotated. Now I'm just going to feel your spine all the way down, just to see if there's any curvature, and there doesn't seem to be. However, you are slightly concave in your lower back, which means you are slightly lordotic. Right here is pretty good, however you don't have a very big concave curvature right here. And the space between your scapula and your spine is slightly larger than most, so you would be protracting, and the area in between your scapulas are good, so you're not very winged. And so would you mind turning around to the lateral side? Just to the side? Great. Alright, so now I'm just going to scan, and your feet are still laterally rotated. This one seems to be more laterally rotated, and your shoulders are forward, and your hands are more forward in front of your body. And your head is slightly shifted forward. So I'm just going to go in, and I can still feel that flat foot, and this ankle is definitely going into the middle. And this calf, good, you're putting a lot of weight on that side. And I'm just going to feel the back bone right here, and then the bone that sits in front right here. And this is slightly higher than this one. It's a little bit higher than normal, so you would have an anterior pelvic tilt. And your shoulders, your hands are immediately rotated, and your head is slightly shifted forward because you don't have a very big concave curve in your spine. Alright, turn to the other side for me. Great, I'm just going to palpate one more time just to confirm what I see. So, your ankles again, caving in, and this one is definitely smaller, and I'm going to check your anterior pelvic tilt one last time, and it is quite the same on this side as well, where your hands are immediately rotated, and that's probably due to the fact that your shoulders are immediately rotated as well. And this clavicle is definitely protruding more than normal, and I'm just going to feel your spine all the way down, and again you are very concave down here, however this is pretty normal. And again, you don't have a very big curvature right here, which produces your head to move forward. Alright, turn and face the front one last time. And I'd just like you to go like this. and you do have a carrying angle that's slightly larger than most. And other than that, I'm just going to record what I find, and that is it for your personal assessment.